enough attention. The CDC just voted unanimously to add the COVID shot to childhood immunization schedules. Some members of the panel at the CDC were wearing masks during the vote, even though they were inside on a Zoom call, to give you a sense of the caliber and emotional condition of the members of that panel. This decision will harm children. There's literally no question about that. Many states directly peg their vaccine requirements to the CDC's schedule, and that means children will be forced to get this vax, which is unnecessary, scientifically unjustifiable, and dangerous, in order to get an education in this country. Now, the CDC denied our reporting on that. They lied and said that's not true, but it is true. It's absolutely true, verifiably true. Fortunately, officials in several states, including Florida, Texas, and Kansas, are not going along with this. They announced after our reporting that they will not comply with the CDC's new vaccine schedule. Dr. Jet Nesheiwat joins us to assess what's going on tonight. Doctor, thank you so much for coming on. So people who want their children to receive this vaccine can, of course, give their children this vaccine. Why would the CDC put this on its schedule? Do you have any idea?
Yeah, you're exactly right. Maybe profit. There's no good reason to have a vaccine that can't stop disease, can't stop transmission of disease on this scheduled vaccination. You know, Tucker, I've worked the front lines. I have literally taken care of thousands of COVID patients the past 2.5 years, many of which were children, none of them that I had to hospitalize. But yet today we see the CDC vote to put COVID-19 on the childhood vaccination schedule, you know, up against the polio vaccine, which actually helps you prevent you from catching paralysis, prevents you from developing paralysis, right. Or the measles vaccine, which prevents, you know, encephalopathy, inflammation of your brain, or blindness, or even, you know, up against the hepatitis vaccine that helps prevent destruction of your liver. But yet they want to add COVID-19 for children. What will that do? Help reduce a sniffle? You know, it's important to understand that almost 86% of children have natural immunity. And a recent study out of the University of Indiana just found that that natural immunity in children is actually stronger and lasts longer for protection, more so than compared to adults. So we need to keep that in mind. But yet they want to put this vaccine on the schedule that shows no benefit. There's no data or evidence that shows it's of benefit. And there's no data or evidence that shows it can prevent disease and it can prevent death. This vote was irresponsible and illogical.
I mean, on some level, they're discrediting all vaccines, including vaccines like the ones you mentioned, the polio vaccine, which I think most reasonable people are very in favor of. This is so reckless and crazy that people wearing masks on Zoom calls are going to scare Americans away from all vaccines.
Yeah, we need to stop with the fear mongering. We're no longer in a COVID emergency. Today, my shift that I just finished a few minutes ago, I only had about 3 cases that were positive. Everyone's symptoms were very, very mild. It's time to get back to the basics and understand we are putting these stringent restrictions and guidelines on the lowest risk population, our children. They've already suffered enough. What we need to do is focus on catching up as far as schooling, you know, their grades, math, reading, writing, anxiety, depression, drugs, addiction, all these things that they're suffering from. We're only making it worse. Only about 1/3 of children are vaccinated. What are you going to do? Keep them out of school if they're not vaccinated? That's just a disaster waiting to happen. I hope and pray, Tucker, that each state, you know, realizes that it's important to respect the science, respect the data, and make the right decisions when it comes to drawing the line.
I hope so, too. Dr. Jet Nesheiwat, thank you very much.
Thank you, Tucker.